Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. If your loved one has been diagnosed with Parkinson's disease, you might be feeling lost, confused, scared, and overwhelmed with concern. It's a diagnosis no one wants to hear, but one that far too many families are impacted by year after year. In fact, according to Parkinsons.org, about 10 million people worldwide are diagnosed with this disease each year. It's estimated that about 1 million Americans have Parkinson's disease today. That's more than those who have muscular dystrophy, multiple sclerosis, and ALS combined. Those are staggering numbers, but what exactly is Parkinson's disease? How can we provide the care our loved one needs after a diagnosis? How can we care for ourselves? What can we expect in the years ahead? On today's episode, it's all about understanding Parkinson's disease. By the end of this episode, you should have a much clearer understanding of what your loved one is experiencing and how you can prepare for what's to come. Let's start with the basics. With numbers as staggering as the ones previously mentioned, it might not be surprising to learn that Parkinson's disease is the second most common age-related neurodegenerative disease in the world. The most common of these diseases is Alzheimer's. To learn more about Alzheimer's disease, head to our episode page to listen to our mini episodes about understanding Alzheimer's and dementia. Because Parkinson's tends to be age-related, most people are diagnosed over the age of 50. However, it's estimated that about 4% of Parkinson's patients are diagnosed at a younger age. One famous example is Michael J. Fox, who was diagnosed with early onset Parkinson's at the young age of 29. The cause of the disease is largely unknown, but the effects are clear. When a person has Parkinson's, the brain cells that produce dopamine become impaired or die. Because dopamine controls movement, when these neurons are no longer functioning, movement is drastically impaired. It is unclear what exactly causes these neurons to misfunction or die. In addition to dopamine, the nerve endings in a Parkinson's patient's brain that produce norepinephrine are lost. Norepinephrine sends chemical messages through the sympathetic nervous system, which controls heart rate, blood pressure, and other automatic body functions. Scientists believe that this is why Parkinson's patients often suffer from irregular blood pressure, slow movement of food through the digestive tract, and fatigue. Many people with Parkinson's also have Lewy Bodies in their brain cells, which are clumps of abnormal proteins inside neurons. Lewy Bodies most often form in the parts of the brain that control memory and movement. This is why many people with Parkinson's also suffer from Lewy body dementia. To learn more about that condition, listen to our episode on understanding Lewy body dementia. While it's unclear what exactly causes Parkinson's, some cases appear to be hereditary, while others have been linked to genetic mutations. In most cases, though, the diagnosis appears to be random. Researchers do believe that the disease might be caused by environmental factors such as exposure to toxins or head injury, but not enough consistent evidence has occurred to pinpoint a straightforward cause. We can only hope that over time scientists will gain a better understanding of why the disease occurs in the first place. Parkinson's disease varies widely from person to person. That means that while some symptoms are more frequent or expected, there's no way to predict what specific symptoms one person might experience or when they might experience them. Parkinson's disease is diagnosed clinically, which means that the disease cannot show up on brain scans or through blood tests. Instead, a diagnosis is based on a doctor's examination of a person's medical history and evaluation of symptoms. If you're worried that you or a loved one might have Parkinson's disease, but have not yet received an official diagnosis, you might want to see a movement disorder specialist. Movement disorder specialists are neurologists who specialize in Parkinson's disease, among other movement disorders. These doctors will be able to carefully assess the patient and symptoms and make a diagnosis off of his or her specialized expertise. So, what exactly are the symptoms of Parkinson's disease? Again, the symptoms do vary from person to person in terms of both the severity and the types of symptoms. Still, there are three movement symptoms that are particularly common, especially in the early stages of the disease. These three symptoms include stiffness, slowness of movement, and a resting tremor. It is possible for a person to just have one of these symptoms or have all three. Even if you or your loved one is experiencing only one of these symptoms, it's well worth your time to schedule an appointment with a doctor. The tremor will look like a slight shaking of the hand, finger, thumb, or chin. Commonly, the tremor will occur during rest in the early stages of the disease. It is sometimes called the rolling pill tremor, because if a person rests a pill in their open palm and it rolls, the hand may be experiencing a tremor. Other common early signs are more subtle. Small handwriting is one of these. If a person's writing has gotten smaller or the words are crowded together, this could indicate Parkinson's. Loss of smell is another early symptom. Have your loved one try to smell certain foods, like bananas or licorice, and ask them if they are able to smell them clearly. If not, this could mean that they are suffering from Parkinson's disease, and you should get them to the doctor for an examination. In addition to smell, voice can be affected early on in the disease. If a person is speaking much more quietly than usual, to the point where they sound hoarse or like they are whispering, this could be a sign of Parkinson's. Other common early symptoms include restless sleeping, depression, constipation, stooping over, or dizziness. You might also notice that your loved one has what's called a masked face. If your loved one has a constant angry or serious expression on their face, they might have Parkinson's disease. Parkinson's can be misdiagnosed in the early stages, especially for patients who are not suffering from tremors or muscle stiffness. Some of the other symptoms can be misconstrued as normal parts of aging. If you feel that your loved one might have Parkinson's but they weren't diagnosed, have them see a specialist for a second opinion. There are 5 common stages of Parkinson's, although again, not everyone goes through this disease in the same way. The following 5 stages are the most typical patterns of progression as observed by doctors and scientists. In the first stage, a person has mild symptoms, such as a tremor or changes in posture or facial expressions. These symptoms won't usually interfere with daily life. Typically, a person in the first stage will only notice tremors or movement difficulties on one side of the body. Within 3 to 7 years of diagnosis, most patients will notice moderate changes to these early symptoms. This means that they have officially entered stage 2. Stage 2 of the disease, or the moderate stage, tremors and movement difficulties increase in severity. While in stage 1, zipping a jacket might have been somewhat difficult, it might now take a significant amount of time to do. A person's posture might start to slump or droop more severely in this stage, and a person might find that their tremors and muscle stiffness have moved to both sides of their body. A person in the moderate stage of Parkinson's can usually still care for themselves, but will take significantly more time to accomplish simple tasks. Some patients at this stage might request more help with daily activities. Stage 3, the middle stage of Parkinson's, is the big turning point for most patients. Reflexes will decrease as will balance. A risk of falling is increased between a patient's struggle with balance, walking, and posture. Patients at this stage will likely need a wheelchair to get around. A patient at stage 3 is able to maintain independence, although they will take longer to eat and get dressed and might desire a little extra help to get things done around the house and to run errands. In stage 4, a person can no longer be independent. While a person can stand from a chair without extra help, they won't be able to walk from the chair to their bed or wheelchair on their own. A patient in stage 4 will need help to eat, dress, and bathe, and move around the house. A person in stage 5 of Parkinson's will require around-the-clock care. Advanced leg stiffness will likely make it impossible to stand or walk, and a person will require a wheelchair. If a Parkinson's patient is also suffering from Lewy body dementia, then they might be experiencing increased hallucinations or delusions by this stage. Not everyone with Parkinson's makes it to stage 5 of the disease. While Parkinson's disease is certainly severe and complications from the disease are the 14th cause of death in the United States, a person with Parkinson's can live well with the disease. Michael J. Fox has proved that people can maintain a high quality of life after a diagnosis. The disease is a progressive one, but the level of progression varies from person to person, and there are some steps a patient can take to slow the progression. Have your loved one work with their doctor to establish a treatment plan. A combination of therapy and prescription medications can help a person with Parkinson's maintain a high quality of life. Doctors will likely prescribe dopaminergic medications to help with the impaired dopamine neurons in the brain. While medications cannot cure the disease, they can improve symptoms to make daily living a little easier. In addition to medications, patients should get plenty of exercise. In the early stages, it's important to get those stiff muscles moving, so activities like biking, running, tai chi, yoga, and dance are all recommended. Exercise will help a person to maintain their balance, mobility, and activities of daily living. Exercise will also improve many symptoms. According to Parkinsons.org, people with PD, or Parkinson's disease, who start exercising earlier and a minimum of 2.5 hours a week experience a slow decline in quality of life compared to those who start later. Establishing early exercise habits is essential to overall disease management. Of course, exercise will come with its own set of challenges for Parkinson's patients. Balance issues, trembles, muscle stiffness, and endurance can all pose challenges to exercising, but there are plenty of ways to exercise safely. All Parkinson's patients should consult their doctor before starting a new form of exercise and should ask for a list of recommended exercises based on their symptoms. Physical therapists will help patients with safe, specialized exercises meant to improve symptoms. Physical therapists will often recommend a routine exercise regimen that includes aerobics and resistance training. There are also community classes in most cities meant for people living with Parkinson's disease. These classes cover everything from dance to boxing and are catered towards improving symptoms and slowing progression in patients. There are surgical options for patients with Parkinson's disease. Deep brain stimulation, or DBS, is one surgical therapy that many patients can benefit from. The surgery works by implanting an electrode into the affected area in the brain. The electrodes are then stimulated with a device located under the skin in the chest. This allows brain to control movement at a normal level. DBS is not a cure for Parkinson's, and it does not help with non-motor symptoms such as depression, loss of smell, or constipation. Before considering this surgery, be sure to get an evaluation from a movement disorder specialist. DBS is not the best choice for all patients, but a specialist will help your loved one determine if it's the best choice for them. Patients with Parkinson's can also assemble a care team of specialists, from home nurses to occupational therapists and neurologists, to help with treatment. The more organized and structured a person's care plan is, the better. When considering the type of care a person with Parkinson's needs, it's important to think about where they will be living, from assisted living to at-home care and everything in between. There are plenty of living options to consider with your loved one. To learn more about the best living options for your loved one, check out our episode on choosing the right care for seniors. Because depression is a common symptom in patients with Parkinson's, it's important to make sure your loved one is mentally stimulated. It's estimated that 50% of patients with Parkinson's suffer from depression, while 40% face anxiety. According to Parkinsons.org, the Parkinson's Foundation Parkinson's Outcomes Project found that taken together, mood, depression, and anxiety have the greatest impact on health status, even more than the motor impairments commonly associated with the disease. Depression in Parkinson's is a direct result of changes in brain chemistry, as the parts of the brain that control mood, energy, motivation, and sleep are impacted by Parkinson's. Social isolation can make the depression even more severe, so make sure your loved one is engaged in social activities, from visits with the grandkids to clubs and organizations. And make sure that your loved one has something to look forward to, whether trips to the movies or the park, visits, or a nice dinner. Having something to look forward to can help enhance a person's quality of life and give them something positive to think about. According to Parkinsons.org, The best approach for treating depression is a combination of antidepressant medication, counseling, exercise, and social support. A counselor can provide essential support and can recommend coping skills to help with positive thinking. There are therapists and counselors who specialize in Parkinson's disease. Additionally, plenty of support groups exist within the Parkinson's community. Introducing your loved one to people going through similar difficulties can help them to feel less alone in their struggle. Caring for a person with Parkinson's also means caring for their home. Make sure that there's nothing at the home a person can easily trip over, like throw rugs, electrical cords, or slippery floors. Clear pathways, placemats in bathtubs and showers, and arrange furniture so it's not blocking any walkways. If you want to provide additional support for your loved one, you can help them by volunteering to exercise with them, which will keep them motivated to exercise while allowing them a great opportunity for socialization, and it gives them something to look forward to. Getting your loved one out of the house as often as possible is key to their happiness. Also, it's isolating to be alone in the house all the time, so any excuse to get out will be welcomed as long as the person is feeling up to it. While this is more difficult during the pandemic, consider taking your loved one on a walk to the park or to an outdoor movie. You can also set up a projector in the backyard so your loved one can be outside, engaged in something fun and comfortable. And finally, it's important to be patient with your loved one. Don't rush your loved one through getting dressed, standing up, or eating dinner. Remember, they are going as fast as they can, and rushing them will only make them feel more frustrated. I know that this disease can be endlessly frustrating and disheartening for family members, so make sure you have an outlet to express yourself that's not the person suffering. Go to friends, family, a therapist to vent frustrations so you're in a better state of mind to be patient with your loved one on the next time you see them. A Parkinson's diagnosis is never easy, but with the right knowledge, preparation, and treatment plan, you can know what to expect and make the journey as positive as possible for you and your loved one. We want to thank you for joining us here at All Home Care Matters. All Home Care Matters is here for you and to help families as they navigate long-term care issues. Please visit us at allhomecarematters.com. There is a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And if you know someone who could benefit from this episode, please share it with them. And remember, you can listen to the show on any of your favorite podcast streaming platforms and watch the show on our YouTube channel. And make sure to hit that subscribe button so you never miss an episode. Please join us next time as we talk about caring for the caregiver. Thank you.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.